Hello everyone, welcome to SALVY'S World Vocast, a vocast where we'll teach, educate you and equip you with the knowledge that you can use to save your life, the life of your family members and anyone you can come across. Today's topic is going to be a serious topic that has now become an issue in the global. So I have people here that can help to give us a full gist about this, and that topic is nothing less than cervical cancer. So I will allow them to introduce themselves.
Hello, my name is Nosbeta Oyemachi and I'm here to talk on the topic cervical cancer.
Hi, I'm Chinyere Nancy Chisimdiri. I'm a student nurse of St. Anthony's College of Nursing. We're here to talk on cervical cancer. We are here to educate you to make you understand about the topic cervical cancer. Thank you.
Thank you so much for being part of this great podcast today. So without wasting much of our time, we'll be going into details about this topic of cervical cancer. So, Nurse Benita, I would like to know actually what is this cervical cancer all about? Is there any definition about this cervical cancer so that the audience who are watching us can know what cervical cancer is?
Thank you, Nosande. So let's talk about cancer at home first. Let's get to talking cancer. So cancer can be seen as a term that encompasses about disease caused by the uncontrollable growth of abnormal cells in the body. These cells multiply, they invade, they spread, and then they damage other surrounding cells and organs in the body. They disrupt the normal body functions of the person. Now, cervical cancer, cancer to say, can be caused by genetics, the predisposition that's from the parents to the offspring. They can be caused by UV rays, that's ultraviolet radiation, and they can be caused by normal lifestyle activities, that is certain exposure to chemicals. Now back to your topic. The cervix is the lower part of the uterus that connects the uterus to the vagina. Now cervical cancer is caused by the growth, the uncontrollable growth of abnormal cells in the cervix. Now this cancer can actually be detected and treated on time if it was actually diagnosed with HSF at the early stage of this cancer. Now, thousands of women die every year from cervical cancer due to the fact that it was not treated yet.
Wow. Thank you so much. So, I honestly love the way you explained this cervical cancer, even going down to telling us what a cancer is, telling us that it's just an abnormal growth at the cervix. So, thank you so much about that. Now, we would like to know about the causes of this term or this disease called cervical cancer. So, Nurse Nancy, are there things that do cause this cervical cancer, or does it just appear as it is, or just grow out from nowhere, or get things that really triggers it?
Okay, the causes of cervical cancer. The main cause of cervical cancer is the human papilloma virus, which we know as the HPV. This virus normally spread due to sexual contacts, and this virus rarely have symptoms. That's why a lot of women have the symptom have the virus without even knowing that they have it. And this virus, for abnormal cells, it takes up to 10 to 20 years to develop into cancer, which is very, very bad for the system. And there are a lot of risk factors that triggers this cervical cancer in the body, which include having multiple sex partners. That's never advisable. We have early sexual activities, we have smoking, we have poor immune system, poor access to health care, and poor hygiene, which is very, very bad. We all know that we have to be clean, we have to take care of ourselves very well. Go for medical checkups if you see any symptoms or in your body, any changes. And also, family history plays a role in this cervical cancer. When a woman has a closer relative that has this cervical cancer, the person is at risk of having this cervical cancer also. And also, long-term intake of contraceptive pills, we all know it as the abortion pills, is really, really bad. It causes the cervical cancer. Thank you.
Thank you, Nurse Nancy, for that wonderful explanation about the causes of this disease called cervical cancer. So, but actually, it's good to know about the causes. And I think it's also good to know more about the signs and symptoms, because I believe many people has or do have some signs about this thing, but it failed to recognize it. So, Nurse Benita, can you actually tell us what signs that one will be seeing, and the person can now say, okay, this can be a sign of cervical cancer?
Thank you, Lord Savvy, for that wonderful introduction. Now, cervical cancer doesn't actually have any signs or symptoms in the early stages. This is why many women are not states that yes, they have cervical cancer until it becomes more advanced and an untreatable stage. But due to certain medical researches, we have found out that cervical cancer has certain symptoms that we're able to use to identify it, such as abnormal vaginal discharge, unusual vaginal bleeding, pain during sexual intercourse, bleeding after sexual intercourse, lower back pain, fatigue, weight loss, and even swelling in the legs. Now, doctors use certain methods to diagnose patients with cervical cancer. They use the pathway method, they use the HPV test, that is the human papilloma test, they use the capnoscopy and the biopsy. Now, any detection of this cervical cancer helps one to be able to treat it successfully.
So thank you so much about this explanation about the signs and symptoms. I believe when some people will start seeing these signs, they will say, okay, this thing can be related to cervical cancer. Let me go and see a health practitioner so that the person can actually tell me what the cause might be. I really appreciate these signs and symptoms that you just explained now. So without wasting much of our time, it's not enough to know about the signs and symptoms. I get things that we can do to prevent this cervical cancer from spreading. Are there some preventive measures one can take? So, Nurse Nancy, can you help us with it?
Yes, there are a lot of preventive measures to take, which include educating others. It's very, very important to educate others, make people know, make women to know about this cervical cancer, make them to know that there is good news in this cervical cancer, because it's one of the most preventive cancers in the world. And also go for regular screening to ensure that you don't have the cervical cancer, because it rarely shows symptoms. And also maintain the safe sexual behavior. Thank you.
So, as my colleague here have said, I will continue from where she stopped. So, cervical cancer can be prevented through taking HPV vaccination, that is human papilloma virus vaccination. This vaccine gets to young girls at the age of 9 to 12 or 14 years. This helps to prevent and reduce the risk of getting cervical cancer. We also have avoid tobacco and smoking. Now, most people think that smoking weed just affects only the lungs. No, it affects and increases rates of a woman getting cervical cancer. We also have you to maintain a good and healthy lifestyle, such as taking fruits, daily exercise, and taking vitamins to strengthen your immune system.
Wow.
Also, you have to meet medical practitioners once you notice some of these symptoms, and also try to maintain a good sexual behavior, as I've said before. And also, these abortion pills, they also cause cervical cancer. We have to avoid the long-term use of contraceptive pills. Thank you.
Wow, thank you so much about that. I really appreciate what you guys have done so far. Your explanations, even a layman that is watching this video right now will be able to know what to do. I think, in fact, you guys are good. So, like a routine that we have in Service World Focus, we always go home with a special word of advice. So I will allow you people to advise our audience so that when they will start seeing things like this, they will be able to know how to do it. So please, the floor is yours.
Okay, word of advice to you is that you please, anytime you notice some of these symptoms that we have mentioned so far, be able to meet medical practitioners, the doctors, meet your doctors, so that you save yourself, you be on the safer side from this cervical cancer. And also, don't forget to educate others, make others, market women, everybody, make them to understand about this cervical cancer, being able to share this information. Thank you.
So, as my colleague has said before, I just want to add to it by saying cervical cancer is real, cervical cancer is out there. It's not all about knowing the symptoms, it's also about knowing the preventive measures, as she has also explained before. Please try to prevent it as she explains in book.
Wow. Thank you so much for your honest advice. In fact, I really say that you guys are good. Even the audience will tell that you guys are good at it. Now, you guys watching us right now, know that cervical cancer is preventable. Don't wait till the signs and symptoms are high. Just go to the hospital, go for your regular checkup. And if you know that you learned something new in this video, do well to share it, subscribe, like, and comment. Thank you so much. I remain your honorable host, Nurse Ogo Salvation. Bye.